Today is World Thyroid Day. I will be speaking few basics which will be helpful to thyroid patients. So starting with what is thyroid? Thyroid is an endocrine gland which is present in the front part of your neck in the middle that produces two hormones. One is T3 called triiodothyronine and another one is T4 that is thyroxine. Both of these hormones will control how our body will store the energy and utilize the energy. That is called metabolism. So what is the most common thyroid disorder? We see most commonly hypothyroidism. Hypo means low. That means the gland will produce less hormones than required. So in this situation, the patient will be having multiple symptoms. For example, the most common general symptoms are excessive tiredness. Patient will feel easily tired. They will be having cold intolerance and dry skin and excess hair fall and also sluggishness in the daily activities. So moving on to specific symptoms, thyroid will be affecting all systems of the body. For example, in the cardiovascular system, hypothyroid patient will be having slowing of heart rate and weak contractions of the heart muscles, which will be causing poor functioning of the heart. Also, the same thing with the respiratory muscles. They will be functioning weakly. So because of this, patient will be having excessive tiredness and their exercise capacity will be reduced. And hypothyroid also affects your brain. It decreases your thinking process and also sometimes you will be having poor memory. And moving on to gastrointestinal system, the bowel movement will be reduced and hypothyroid patients will be having constipation. And in the reproductive system, especially women will be affected where their menstrual cycles will be irregular and they even have the problem of infertility. If a pregnant lady becomes hypothyroid, she will be at risk of early abortions also. Hypothyroid patients also they will be having increase in their blood pressure and increase in their blood cholesterol level. These complications are also seen in those patients. So treating these patients will avoid all these symptoms and complications. So whom should these patients consult? So most of the hypothyroid and any thyroid related problems can be effectively managed and treated by an endocrinologist on an outpatient basis without any hospitalization. He will be ordering simple blood test to confirm your diagnosis in which we will be measuring two hormones. One is TSH called thyroid stimulating hormone and other is T4 that is thyroxine. Based on these two hormone levels, we can confirm your diagnosis and decide the severity of your hypothyroidism. Then he will be starting you on thyroid replacement therapy. So the thyroid replacement therapy will be given in an oral form, that is thyroxine tablet in a synthetic form called levothyroxine. You have to take this tablet early morning daily once. So how the starting dose will be decided? So your endocrinologist will decide the starting thyroxine dose based on many factors. For example, weight. When your weight is high, you need higher doses. And another factor is age. For children, for older people, and for adults, all of them has different age groups and they need different starting doses. That will be decided by your endocrinologist. And another factor is what is the cause of your hypothyroidism. It can be autoimmunity or it can be because of thyroid cancer patient got treated with surgery and many other causes. Even for every different cause, we need to start different doses. I will be telling you some few tips how to take these tablets regularly and properly. So first and most important thing is you should take this tablet empty stomach without any fruit juices or any coffee. You should use only water, and then you should not take the tablet without water because while you are swallowing it, it may get crushed or it may get absorbed in your mouth or throat. Then it won't be absorbed properly. That is also one important precaution you have to take. And another important thing is you have to take it every day on a regular time so that you won't be forgetting it. Most of the people will use the technique simply after brushing their teeth, they will be taking this tablet. It works well for many. So this is are the tips to take your tablet properly and regularly. And another important question is, what should I do when I skip the tablet? So I will tell three different scenarios how to manage, how to handle that situations. If you remember in afternoon that you didn't take your tablet in the morning, you can take in the afternoon, but make sure that you don't consume food until 1 hour after you have taken the tablet. And also you should take the tablet at least 2 to 4 hours after taking the food. This is one thing. And another situation is, you are sick and you vomited the tablet. Then what I should do? No need to take the repeated dose. You can wait till tomorrow and then you can take the next dose. But remember, if you are a pregnant and because of morning sickness, you have vomited out the tablet, then you have to take the tablet on the same day, anytime, whichever is comfortable. You should not skip the tablet. And another situation is when you remember that you forgot the tablet yesterday. So you can take both doses today. So this is how you have to handle. But missing one dose, that's fine. But if you miss multiple doses or if you miss doses every week, then it will be like you are taking under treatment. Again, your symptoms of hypothyroidism will come back. I would like to give you all one good advice, that correct functioning of your thyroid gland is very important for your healthy life. So go and get your thyroid functions tested and have a good advice from your endocrinologist available in your place.